Have you ever wondered how doctors figure out exactly how much medication to prescribe and how often a patient needs to take it to keep them safely in the therapeutic zone? It all comes down to a beautiful mathematical dance between two core pharmacological concepts: clinical half life and steady state. When we talk about half life, we are looking at the time it takes for the concentration of a drug in the plasma to be cut in half. This rate is determined by two major players: how widely the drug spreads out in the tissues, known as the volume of distribution, VD, and how efficiently the body clears it, known as plasma clearance, CL. In first order kinetics, which is how most drugs behave, the math works out to a neat formula where half life is equal to 0.693 times the volume of distribution divided by clearance. To put it simply, if a drug has a huge volume of distribution because it hides in fat tissue, or if a patient's kidneys are sluggish and clearance is low, the half life stretches out significantly. This brings us to the ultimate goal of chronic medication therapy: reaching steady state, which is the sweet spot where the rate of drug administration perfectly matches the rate of elimination, keeping plasma levels stable. But how long does it take to actually get there? Here's the clinical golden rule. It takes approximately 4 to 5 half lives of consistent dosing to reach steady state. Let's break down the math of how a drug accumulates when dosed at intervals equal to its half life. After the first dose, the body is at 50% of the eventual steady state concentration. After two half lives, we climb to 75%. By three half lives, we hit 87.5%. At four half lives, we are at 93.75%, and by the fifth one, we reach 96.875% of steady state, which clinically we treat as a fully stable functional equilibrium. This mathematical reality is exactly why some antidepressants take a few weeks to start working, and why, if we need a drug to work immediately in an emergency, we cannot wait for five half lives. Instead, clinicians will administer a large loading dose to rapidly spike the plasma concentration into the therapeutic range, followed by smaller maintenance doses to simply replace what the body clears. So, whether you are managing a patient on a continuous IV infusion or adjusting a daily pill regimen, mastering the relationship between clearance, half life, and the five-step climb to steady state is the key to safe, predictable, and effective medicine.